Hey there. Dr. Mike Franco, board certified hand surgeon at Cooper University Hospital in South Jersey. We're going to talk a bit today about base of thumb arthritis or CMC joint arthritis. We could also call this why does my thumb hurt right here, or why am I having trouble pinching, gripping, and opening jars? So this is one of the most common things I see in the office, thumb arthritis. This is rarely related to something you've done. This is likely genetic, an osteoarthritis or a regular bone arthritis, and you're just prone to it. This could be related to a previous injury, but often it just happens to a variety of people as the bone or the joint changes over time, causing this arthritis or inflammation in the joint. Now, why does it happen? Well, the base of the thumb joint or the CMC joint is highly mobile. It looks like two saddles sitting on top of each other to create the complex motion we need to bring the thumb around and touch the fingers, called our opposition. Now, over time, those edges start to touch where the thumb joint starts to fall into place as ligaments loosen. This we call a subsidence, or the joint is no longer lined up appropriately. So this causes contact points leading to inflammation. Well, it's treatable. So what do we do? For some patients, splinting may be an option. It's a challenging area to splint, especially if you use your hands quite a bit during the day. The thumb splints that we often use may not be compatible with some jobs, but I'd still encourage folks to wear them when resting at home or at nighttime. I often encourage occupational or hand-based therapy. This is to strengthen the muscles around the joint and the forearm and allow us to offload the joint when we pinch or grip, though twisting a jar is always going to be a bit challenging. Then there are topical applications, creams or gels such as Voltaren gel, that's a non-steroidal anti-inflammatory, or there's been some evidence that CBD creams and ointments or cannabinoid ointments can be helpful. All right, so what about beyond these topical agents? So there are injections. We often do corticosteroid or cortisone injections the same day in the office if you come to see me with significant pain and you say, I just need some relief to get back to life. We can give you an injection that day, and the injection takes a few days to work, but often it gives relief from 3 to 6 months. They're really never lifelong, but often if we go through 2 or 3 injections, we can bring the pain down to a level where it's a workable thumb, and hopefully it's not bothering you enough to go any further. Now, what if these steps aren't working? Well, then we may talk about surgery. And for me, there are a few levels of surgery. So in one case, we talk about a way to reduce the pain from the joint, but we're not necessarily stabilizing the thumb or fixing the arthritis directly. We're doing a thumb denervation. This is a surgery where you have a cut made on your thumb in our outpatient surgery center after your arm is numb. You're also taking a nice nap so you're not feeling anything. I open the skin and identify several small nerves coming from main branches called the median nerve, the radial nerve, and the lateral arm nerve. Branches going down to the joint are identified, and I cut them as they go to the joint. This is our joint denervation. After surgery, you wear a soft wrap on your hand and you baby the hand and take it easy for a few weeks. There's been evidence in the literature that up to 80% of patients can get by with this operation, needing no further operations. Now, in some patients, if there's a large structural problem and the thumb has changed position so much that this operation no longer is viable, we talk about another surgery called a ligament reconstruction tendon interposition. You may look up something called an LRTI, or you may hear me say that. Essentially what we're doing is a joint replacement for the base of thumb bone called the trapezium. We remove this trapezium using that same kind of cut we described before. After we take out that bone, we fill the space by borrowing a portion of a tendon from your forearm and using it as a cushion and a sling to help hold your thumb in a good position. Now, the downside to this operation is its recovery period. Now, for some folks, the thumb's in such a poor position and they're in so much pain, a long recovery time is very reasonable, but it's something we have to discuss. 2 weeks after surgery, you stay in our postoperative splint, which is a wrap with a portion that is hard and a portion that is soft that keeps your thumb still. When you come to see me in the office, we take you out of this, check your wounds, and put you into a cast. sometimes for another 2 to 4 weeks. This just lets the base of the thumb scar in such that it's tough and stable. And then over the next 2 months, we start to stretch it out so you can get back to life with your hand. There's then another 3 months where you're just getting back to using your hand as you would and building up the strength. But certainly that first 3 months, it takes some work. We often say that first month, we're kind of wondering, maybe sometimes, boy, should I have done this surgery? Man, I'm now in a cast and it's very challenging. But once we get through that period, most of my patients notice incredible results where they're feeling reduced pain and the ability to use their thumb again. Well, there are a lot of nuances to these discussions. When you come to the office, if we don't already have x-rays, we'll get them there. I usually don't need any other advanced imaging. We'll review the x-rays and we'll talk about what's right for you. Now, in some cases, the x-rays don't line up. Either they look like aggressive arthritis, but you're not having that much pain, or they look more subtle, but you're telling me my hand really hurts. So we find out the right pathway for you. Well, we look forward to meeting you, and thanks for letting us take care of you.